Influenza, the regular seasonal flu's death rate is only 0.1%. 0.1%. So if you're in Italy, coronavirus is 100 times more deadly. Hi everybody, I'm Dr. Duc Vuong. I'm a world famous bariatric surgeon, author of 13 books. This is my diploma, med school diploma in the background, and also this is my residency diploma. You see my middle name now. It has MD after my name because you have to be graduated med school in order to get it into residency. And then as you can see, I'm a general surgeon and I graduated in 2005. I show you my credentials just because I want you to have more confidence in what I'm about to tell you. And what I'm going to give you an update about the coronavirus, and then I'm going to tell you why the death rate is will be and is a lot higher than what you think it is. All right. So today is March 30th, 2020, and I started following the coronavirus on March 12th because on March 11th, the World Health Organization declared the coronavirus a worldwide pandemic. And I was like, oh man, I better start watching. See, I'm trying to watch my curse words, so I almost said, oh shit, right? So I'm doing better. I said, oh man, I better start watching what's happening here. So on March 11th, March 12th, when I looked, the United States had 1,600 cases of coronavirus, 1,600. Today, on March 30th, we have 156,000 cases and 2,900 deaths. 2,900 deaths. So it's been 18 days, and we have jumped from 1,600 cases to 156,000 cases. So pretty much 100 times the case. By Easter, if we keep going at this rate, by Easter, we'll have over 1 million cases. By Good Friday, April 10th, in 11 days from now, 12 days from now, we are going to have about 1 million to 1.5 million cases in America. And I'm going to talk about death rate today and why it's higher than we think, okay? When I first started talking about coronavirus, the death rate in the United States was surprisingly low. We were 1.3%. Today, we're at 1.8%. And Italy, when we first started, we were noticing that Italy was in trouble. Italy today has 101,000 cases and 11,600 deaths. So when I started reporting on this, Italy had about an 8% death rate. Today it is an 11% death rate, right? If you look at my earlier videos, back when this all started, Washington State in the United States was the epicenter. It had 600 cases and a 6% death rate. New York City had 500 cases and only a 0.3% death rate. 0.3%. Today, New York's death rate, New York, if it were a country, would be 5th in the world in number of cases, right ahead of Germany. It's got 60,000 cases now in New York State alone. And its death rate has climbed from 0.3% to 1.6%. So you do the math. You think about it, right? Everybody is saying, oh, Dr. Vuong, don't panic, don't panic. We only have more numbers because we're doing more testing. Well, if we were doing more testing, so death rate is number of deaths on top, the numerator, divided by the number of cases on the bottom. If we were doing more deaths, if we were testing more, if we were getting more cases, and the number of cases, the denominator was growing faster than the number of deaths, even though the number of deaths is increasing, what would happen to the death rate? It should go down, right? If the number of positive cases is increasing faster than the death rate is increasing, then the percentage death rate should go down. But it's not. It's been going up. What's that mean? Percentage-wise, it means that the number of deaths is going up faster than the number of cases being diagnosed. So it doesn't matter. Look at the logic here, guys. It does not matter that we are testing more. It doesn't matter that we tested more than China. It doesn't matter that we've tested more than the rest of the world. It doesn't matter. Our death rate as a country has gone up from 1.3% when I first checked to 1.8%. We're going to hit the 2% mark here pretty soon, and I'm going to tell you why also. But I'm just pointing out the fallacy of this testing argument, right? I'm pointing out the fallacy. Again, New York State, when I first checked, had a 0.3% death rate. You can go back and watch an old video where I said that the New Yorker with 500 cases and a 0.3% death rate would be foolish if they were walking around outside, ignoring all the social distancing, ignoring the hand washing recommendations, because the death rate in Washington State was 6% at the time. And now, 60,000 cases later in New York State, the death rate has gone up from 0.3% to 1.6%. How? Because the number of deaths has increased faster, the numerator has increased faster than the denominator. Does that make sense? If that makes sense for you, go ahead and hit share for me, because that's a super important point. And I'm going to explain right now why it's going to get worse, okay? The main reason why it's going to get worse is because the hospital systems are going to become overflowed, are overburdened. We are already stretched to the limit. Remember, the coronavirus is a +1. It's an add-on. By that I mean people are still having car wrecks. There are still traumas. There are still shootings. There are still accidents, skiing accidents, snowboard accidents, skateboarding accidents, right? There are still accidents. There are still heart attacks. There are still strokes. People are still having strokes. People are still getting diagnosed with cancer. So the world doesn't stop just because you decide to have coronavirus, right? In addition to that, regular influenza is still happening. Regular flu is still happening. So coronavirus is a +1. You know, before coronavirus, we had there's about 990,000 beds in the hospital beds in the United States. And at any given moment, normally there's about 300,000 beds available. So about a 2/3 occupancy, if you think about it as like a hotel. We're going to get pushed to the limit with this coronavirus, okay? So the number one reason why the death rates are going to go up is because the hospital system is pushed to the limits. I told you 2 weeks ago you were going to start seeing pop-up tents. Comment right now if you're already starting to see pop-up tents in your neighborhood hospitals. And pop-up tents, that is designed to keep people isolated. So if you think you have the coronavirus and you want to go to the emergency room, you're not going to go to the regular emergency room. You're going to go to a pop-up tent where they're going to keep you isolated, right, until they figure out your diagnosis. Now, it's awesome that the coronavirus test, apparently they announced earlier that they might have a 5 to 15 minute test now, as opposed to a 5 to 6 day test. Earlier on, if you wanted to get tested for the coronavirus, it would take you 5 or 6 days to get the results back. That's why we had this lag time. Now there's a possible 5 to 15 minute test. It's not deployed nationwide yet, but they're looking at it really closely. Okay, so you're going to go to this pop-up tent. Now this pop-up tent is going to look weird. It's going to look something like from the movie Outbreak, like sci-fi. And when you go in there, you're going to have the people checking you in. It's not going to be like a nice little young lady at the front desk. They're going to be in full hazmat like outfits, okay, if they have them. If they don't, they'll be definitely face guard. And they also might put you behind a desk. I was at Lowe's yesterday doing some gardening, and they started putting up face shields, like, you know, like gas stations where you can only slide your money underneath the mirror. So it's really crazy, right? So the hospital systems are going to be pushed to the max. Now, why? Why is this important? Because as people start getting sicker and sicker, they're going to get... Remember, I did the video on how the coronavirus kills you. It kills you through a process of progressive pneumonia, multi-lobe pneumonia, that eventually leads to something called ARDS, acute respiratory distress syndrome, and then your lungs, because of the damage, fill up with fluid, and then you can't breathe. I did that sponge demonstration, right? If you haven't seen that video, just look it up on YouTube and share it for me. And someone could put the link for me in the comments. And then, you know, you can't breathe and you suffocate. The only treatment for that is to get intubated and placed on a ventilator. The average time on the ventilator is going to be 2 weeks, okay? So people are still getting sick. Thousands of people are still getting sick every single day, We're probably going to hit a 40,000. We had 22,000 cases in the United States. New cases this last weekend. And we'll get a day where we're going to hit 30, 40,000 here pretty soon. A day. New cases a day. So you have these people on the ventilator for an average of 2 weeks trying to support them and help them off, get through this ARDS. But in the meantime, you're getting this backlog, okay? So you're going to get this backlog of cases. Now, I keep in touch with my other physician friends, my other surgeon friends. I'm in groups on Facebook, and they're reporting terrible stuff. Like they're reporting things like for the first time in their careers as ER physicians, they are sending patient home. Listen now, pay attention. There are ER doctors who are having to send home patients with multilobar pneumonia, which they'd never done before. As long as they could keep their oxygen saturations up with supplemental oxygen. So they're sending patients home with oxygen. Why? Because they're hoping to buy the hospital 1 or 2 days. Maybe the patient will be able to recover at home if they just do their breathing exercises, if they just wear their oxygen mask. Maybe they can buy 1 or 2 days so that to lessen the burden on the hospital. So here's the problem. Here's the problem with that. Remember, you're going to die so unfortunately, people are like, 80% of people recover, Dr. Vuong. Why are you being so negative? Because it's the other 20%. It's the other fucking 20%. It's going to overwhelm the system. And remember, mild case of coronavirus only means that you don't need to be hospitalized. So these jerks that are walking around saying, hey, I don't need to, it's only 20%, it's a mild 80% recover. 20% are going to overrun our hospital system because they're going to require hospitalization. And about 5% are going to need ICU. And of those ICU patients, about half of them are going to need to be on a ventilator to help them get through this. Now, pay attention. We think, based on some studies, once you get on the ventilator with this coronavirus and you are in ARDS, acute respiratory distress syndrome, the mortality rate, if you're on the ventilator, is anywhere from 70 to 86% mortality rate. Mortality means death. If your doctor has to put you on a breathing tube, on a ventilator, and you go into ARDS, your death rate is 70 to 86%. That's worth sharing right now. That's worth knowing. That's why in Italy, they're saying if you're over 80, we're not putting you on a ventilator because your death rate is very high. If you are morbidly obese, why is a weight loss surgeon talking about coronavirus? Because you guys are at risk. My following, you guys are at risk. Right? Morbid obesity puts you at risk. Hypertension puts you at risk. Diabetes puts you at risk. Any sort of previous lung history, that means COPD, you're on oxygen, you have restrictive lung disease, you have bad, poorly controlled asthma, you've ever had any sort of lung surgery, you are at risk. You have sleep apnea, you are at risk. If you have 3 comorbidities, you are at super high risk not to catch it. Everybody's going to catch it. If you come exposed to it, you're going to come down with some variation of that flu-like symptoms. All right? But if you have 3 of those risk factors, you have very high risk for poor outcomes. Poor outcomes. Okay? So once you get on the ventilator, and that's the treatment, we are thinking your death rate is 70 to 86%. Come on now, wake up. Everybody wake up for me. Wake up. Wake up and hit share. This is super important, okay? So our hospital systems are going to be pushed to the max. Now, once these ventilator patients start dying, you're going to see the death rate go up. Remember, the death rate, the average time on a ventilator is 2 to 4 weeks, with the average death coming in 10 to 14 days. About 10 days. So you're stuck at home because you can't go see grandma in the hospital or your mother in the hospital, and she's going to die and you're not going to be there. That's what's going to happen because there are no waiting rooms. There will not be waiting rooms, guys. You're going to be limited to going to see your loved ones from now on. You're going to have to gown up if you want to say your last goodbyes. There aren't going to be family members gathered all around the bed when grandma passes. That day has passed. We are this high up in it, guys and gals. It's time to wake up. Okay? It's time to take this really, really, really fucking seriously. All right, so we're going to get pushed to the max. People are going to get, more and more people are going to get put on ventilators as they develop pneumonia. They start to develop respiratory distress. They're going to put on ventilators. And then what? And then what's going to happen? Then there's going to be that 2-week lag period, and then they're going to start dying, 70 to 80%. Yes, I know they get off. Yes, those are feel-good stories. Yes, I've seen the stories. This person recovered, left ICU. Awesome. But the number seems to be 70 to 86% are going to die once you have a ventilator on. So then you're going to have this 2-week lag period, and the death toll is going to increase. But remember, more and more people are getting sicker and sicker. Your ER physicians, your ER physicians, your doctors are sending people. They're having to. They don't want to. We're just out of resources. They're having to send people home with pneumonia. And some of those people are going to die at home. And those are going to make the numbers go up. Some of those people are going to wait too long, come back to the emergency room, get intubated, and die 2 weeks later. I'm painting a very grim picture. I know. But this is truth. And I'm not fear-mongering. Trust me. I'm telling you this is the direct truth from people that are on the line fighting this. Okay? So that's why the death rate is going to go up. The hospital system is going to get overwhelmed. We're going to run out of ventilators. We're going to run out of equipment, personal protection equipment. We're going to run out. We've already stopped doing emergency surgeries. We are, as surgeons, we're already looking at we pretty much have stopped laparoscopic surgeries. We're putting off emergency gallbladders. Like if you've ever had a hot gallbladder, remember when you had your gallbladder attack, we've stopped operating on those now. They're putting PERC drainage tubes in those now, because we know that we can aerosolize the virus. And we're having patients, we do surgery on them for appendixes, gallbladders, other surgeries, and then we can't get them off the ventilators because they have pneumonia. They came in with pneumonia. They didn't catch it in the hospital. They came in with undiagnosed COVID-19. So that's the reason why. That's the main reason why the death rate is going to go up. Number 2. And we're not talking about this. The other reason why the death rate is going to go up is how? We're going to run out of personnel. By that, I mean literally, we are going to run out of nurses, phlebotomists, physicians. We're going to run out of staff. Right? Physicians and nurses are already working over 100 hours a week. You cannot keep up that pace. I had to do it during residency. The most I ever worked during residency was 140 hours in a week. It was painful. But it wasn't unusual for me to do 100 hours a week. And I did it for freaking 5 years. And I was 4 years, really, because when I was chief, you kind of take it easier when you're chief. But it's a hard pace to maintain. I'm telling you, your doctors are getting burnt out. Your nurses are getting burnt out. Because you got to remember, they're humans too. And today is National Doctors Day. There's never been a National Doctors Day like today. Trust me. They're human. The nurses are getting burnt out. Your physicians are getting burnt out. You've got gynecologists having to run vents. They're not trained to run vents, y'all. Your gynecologist is trained very well to deliver babies. They're not trained to run vents, put in drainage tubes, put in dialysis catheters, put in central lines. That's not their training, but they're having to because the surgeons and the intensivists are pushed to the max already. So the death rate is going to go up just because we're going to run out of personnel. Not to mention the personal protection equipment, gloves, etc. Reason number 3. And this is the saddest one, y'all. The death rate is going to go up because your healthcare providers are also coming down with this. And we're not talking about this. 37 physicians, 37 doctors in Italy have died from COVID-19. Not gotten sick, guys. 37 Italian physicians have died from COVID-19. Not died from a heart attack, not died from exhaustion, not died from a bad date, died from COVID-19. 37. 2 physicians, both surgeons. You know how hard it is to train a transplant surgeon? Transplant surgeon, ENT surgeon in England died this last week. And now England is starting to look at the seriousness of personal protection equipment. And I'm just talking about the physicians. We have colleagues here in America that have died from COVID-19, taking care of patients. We have lots. You just go Google it. There are a lot of nurses and healthcare workers who've become sick from COVID-19. Now, once they become sick, they're just like any other patient. You got to isolate them. You got to do everything. Now, there were some places where it's really bad, and the training for physicians is so hard that even if a physician tests positive for for coronavirus, they were still making them work. Even if nurses and healthcare workers, providers were testing positive for coronavirus, if they were not symptomatic, they were still working. They would just have to be extra precautious with the gloves, the masks, not sneezing, washing, keeping their distance from patients, etc. That's the current state we're in. It's no fucking joke, guys. I promise you that the death rate is going to go higher before it goes down. And these are just the cases we know about. There are people that are not being tested. These jerks who are like, Dr. Vuong, you're a fearmonger because they're just like they're only higher because we're testing more. If that was true, then the death rate would go down. But the death rate has been climbing. The death rate has been climbing. When I first reported this 12 days ago, the death rate in the United States was 1.3%. Now it's up to 1.8%. The death rate in New York City when this first started was 0.3%, and now they're up to 1.6%, despite having 60,000 new cases. Think about that. And it's going to get worse for all the reasons why I told you. The hospital systems are being stressed. Patients will be sent home with pneumonia and told to come back if they worsen. Some of them are not going to make it back in time. Some of them will make it back in time, but just in time for the ventilator. There's a time delay for when you get ventilated, about 2 weeks. There's going to be a backlog of ventilators. So there's going to be a backlog of patients who need to be on ventilators, but there aren't ventilators. There's going to be a backlog of hospital staff to take care of them. So then these patients will start dying later once they get off, once they've been on the ventilator. So there's going to be a lag in those numbers. So the death rate, I promise you, is going to go higher. Look at Italy. When I first started to look at this closely 2 weeks ago, the death rate in Italy was shocking. It was 8% death rate in Italy. We could not believe it. Today, March 30th, the death rate in Italy is 11%. 11 fucking percent, guys. You know what that means? It means huge. We are going to hit 1 million cases by Good Friday, Easter weekend. We're going to hit a minimum of 1 million cases in the United States alone. In the United States alone. With a death rate of 2%, that's 20,000 people by Easter weekend will have died in the United States. And people are still taking this as a joke. People are still saying this is not that serious. People are still saying, you're fear-mongering, etc. We're not. You need to take this much more seriously, right? If you are in Italy, Italians are now up to 100,000 cases with an 11% death rate. So they have 11,000 dead people. That's the math. If they go to 200,000 cases, if they go to 1 million cases in Italy, there's 65 million people in Italy. If they go to 1 million cases in Italy with 11% death rate, that's 110,000 people are going to die in Italy alone. These are grim times. This is why I am imploring you, please take this coronavirus much more seriously. We are not out of the woods yet. Once we are, I will tell you. Once we are, I will tell you that we can chill out. We can just be precautious. We're doing a great job, but we're not. The slopes are still going up. The death rate's going up. We are not on top of this thing. We are not anywhere near through this. President Trump just extended this till April 30th, which was the right thing to do, which I told y'all he was going to do, which I said they were going to cancel schools. They were going to have pop-up emergency hospital tents. It's all coming. You're not going back to work anytime soon. Death rate is much higher. This is a much deadlier virus. Remember that influenza, the regular seasonal flu's death rate is only 0.1%. 0.1%. So if you're in Italy, coronavirus is 100 times more deadly. 100 times more deadly in Italy. In America, it's 18 times more deadly. It's 1.8% death rate. We got to start taking this much more seriously, all right?